All right, good morning, everyone. Thank you for joining us for the members of the committee, the staff, the members, the audience in the gallery, and the people viewing online. I'd like to call this House Standing Committee on Health and Welfare to order. And first item on our agenda, can I get a motion to adopt today's agenda?
So move. Second.
Okay, there's a motion been seconded. All in favor say aye.
Aye.
Those opposed, nay. Ayes have it. Moving down to public comments. If anyone in the gallery has comments to make, you give him 5 minutes, please. Thank you. Please state your name and the entity you represent. Thank you.
Hafaday Tiro, good morning, Chairman and honorable members. My name is Sheila Jack Babauta. I'm here as a concerned citizen and also as president of Community Solutions. I'm here to state my full support for House Bill 23-47. Mental health services, access and coverage is essential for our community's well-being, for us to heal, for us to find support in the many aspects of our lives, because now more than ever, our community is really showing the symptoms of a community that lacks the kind of resources and access we need to mental health services. We are a community that is recovering from generations of trauma. We have climate grief that is happening before us. We have had super typhoons, we've had the pandemic, and a long, long list of ways our community is really suffering. And so I'm here as a huge supporter of mental health coverage to provide equal coverage virtually for virtual services, the way we do for in-person services. As a daughter of the Marianas who grew up with mental health issues in my household, my mother was diagnosed with bipolar schizoaffective disorder when I was 10. I have very personal experience with the type of need that homes deserve. And while I was serving in office, I sought for over a year, had virtual counseling services that was super effective. And so I truly believe in this type of model and I see the need. With the leadership of Dr. Ann Earhart, we have had several meetings with stakeholders around the Marianas, including CHCC, CGC, Medicaid, Department of Commerce, and the Governor's Senior Policy Advisor. There has been overwhelming support for this legislation, and today we are here to offer support and answer any questions that the committee may have. So thank you very much, Chairman Rep. Omar, for sponsoring the bill, for adding it to today's agenda. I look forward to the passage and adoption of this bill, and please use us as resources, and we're here to support this committee. Thank you.
Thank you, Ms. Babauta. Anyone else in the gallery?
Good morning, Chair Omar, Vice Chair Flores, and committee members and staff. I'm Dr. Ann Earhart, a licensed clinical psychologist who's been practicing in the CNMI for 26 years in both the public and private sectors. I'm representing myself as well as my colleagues, Dr. Adrian Bren, Dr. Janet McCullough, Dr. Jennifer Maratita, and Dr. Amanda Borja Hughes, all licensed clinical psychologists. First, I'd like to express our appreciation for your consideration of the Mental Health Coverage Act. It's the logical next step after the passage of PSYPACT last year. When the CNMI became a member of the PSYPACT, or the Psychology Interjurisdictional Compact, or PSYPACT, it gave the Commonwealth access to a much larger pool of psychologists than what we currently have available here by allowing us to receive services from authorized psychologists via teletherapy. This is an important step in helping us meet the mental health needs of the CNMI. As you may know, the federal government put into place waivers during the COVID-19 public health emergency to allow easier access to medical and mental health services through telehealth. Even though the public health emergency ended May 11th of this year, and many of the waivers will remain in place for mental health for varying periods of time, one insurer operating in the CNMI has already terminated coverage for mental health services delivered via teletherapy. Most states have spent the last 2 or 3 years writing and amending their telehealth laws to permanently reflect the new landscape we're in, where telehealth is here to stay, especially for mental health. The CNMI has no mental health laws. In particular, we have none that ensure ongoing coverage for mental health. The Mental Health Coverage Act will address this by making sure that mental health services delivered through telehealth are covered by private payers and government health plans, including Medicaid, and that payment for mental health services delivered by telehealth is the same as for in-person visits. With this bill, people seeking help through telehealth will know that these services will be covered by their health plan, that services delivered through interstate compacts will be covered, and that costs will not be higher. Telehealth legislation has now been enacted in all 50 states, the District of Columbia, Puerto Rico, and the U.S. Virgin Islands. We hope that with your support, we can protect access to mental health services in the CNMI and ensure that people do not have to pay more than someone receiving in-person services. Thank you for considering this very important mental health legislation.
Thank you, Dr. Ann. Also, for this giving oral statements and comments, if you want, you can submit your written comments for the record. Thank you.
Good morning, Chairman Omar, Vice Chair Flores, and members of this committee. My name is Joseph Kevin Villagomez. I am the director for the Community Guidance Center, representing not just CGC, but CHCC in general. And our CEO, Dr. Estemuña, has submitted a unified statement in support of this legislation. And we want to thank you particularly for addressing it today and looking forward and hoping of its passage. But from the healthcare perspective or the behavioral health perspective from the government side, on a daily basis, I have to balance the act of addressing immediate crisis and potential crisis. And then what are the aftercare counseling that may happen down the road. And we do our best to hire, but as you all know, if we're having difficulty hire physicians for the hospital, we have doubled the difficulty in hiring psychologists for the government and keeping them here in the long term. So we're working slowly in workforce development by working closely with our college in hiring those that are just recently graduated as counselors and training them to do the initial assessment, and then we can refer to the next level of care. And this law will provide that next level of care. If there's any silver lining, I'm sure you've heard this of the pandemic, it showed us that telehealth and telemedicine and any tele-related work and stuff really does work. And we have telehealth capabilities now for veterans to seek substance abuse counseling that is set up already at CGC, and we want to be able to expand. I don't think the difficulty will be in finding the equipments to get this going. It's in allowing us to identify pool of clinical professionals from within the regions or outside of our region to be able to address our needs. So on behalf of CHCC and CGC in particularly, we are in full support of this legislation and we look forward to your action on it.
Thank you, Mr. Villagomez. Anyone else in the gallery? Okay, we've also received several comments, which will be on file also to take into consideration for passage of this, for action of this bill. If no further comments, we're going to move on to item D. Okay, so Section A, House Bill 2347, to establish parity in coverage and payments for mental health services delivered through telehealth and in person. Any discussion And at this time, if we have any questions, the supporters of the bill also are open to answering any questions from the members. Rep. Repogo.
Thank you, Chair. After reading this bill, it is very critical coming from the First Senatorial District with the limited access to transportation, which is mainly the airline. And I'm not sure how many, patients has been referred to seek and receive treatment for mental health, but we see, patients in order that are having challenges seeking that because of the limitation of transportation, and also with the increase of airfare, they're financially, challenged with that in that area. So I am hoping that this bill goes through. I'm in support of it. Thank you, Chair.
Thank you, Rep. Any further discussion? Vice Chair.
Thank you, Chair. I also would like to let the committee know that I am in full support of this bill. I am also a receiver of telehealth therapy, if that's what you want to call it, during the crisis of the pandemic. And I think that it's important because not only does it provide the needed help for the individual, but it allows access and it increases access to that type of support. And anytime that a bill is aimed to provide assistance, but also allow 100% accessibility, I think that is very important. So I fully support this bill. I don't have any other comments or questions for the professionals in the gallery. I do support it, and I think that it is time as we start to transition into more technology. Eventually, we'll probably see the phase out of in-person visits, and we'll be transitioning more into telehealth. So I yield. Thank you, and thank you, members in the gallery, for your comments.
All right. So, yes, I just want to express also my gratitude, thanking Sheila and Dr. Ann and everyone in the gallery for your support and stuff, and for allowing me also to sponsor this bill. And I see we've had positive feedback from other stakeholders and stuff. And so when we introduced it, just to go through the formality to passing it through for action. But again, this is just an added coverage and an added layer to the services that's provided, and for also services that we can offer to our people of the Commonwealth. So I thank you again for allowing me to sponsor the bill and to introduce it here in the House. And without further discussion, I recognize the Vice Chair for the motion, please.
Thank you, Chair. Can I get a motion to move? I motion to move the House Bill 2347 out of committee to have the LA prepare the report, subcommittee report for action for next session. So move.
Okay, there's a motion and has been seconded. No discussion. Ready? Okay, all those in favor of the motion say aye. Any no opposed? The ayes have it. Motion carries. At this time, I call for a short recess. Thank you. This committee will rise back from recess. Before moving on to the next agenda, I'd just like to thank again the supporters of this bill and officially dismiss you unless you want to stay back for the next item. You're more than welcome. Thank you again very much. But thank you again for taking time to be here with us. Thank you, members. So moving on to Senate Bill 2305 to transfer the administration of the CNMI government's health, group health, and life insurance from the Department of Finance to the Office of Personnel Management and authorize furloughed government employees to continue to receive their group life and health insurance benefits and for other purposes. I open the floor for discussion. Recognized Vice Chair.
Thank you, Chair. Can I?
Sir, can I request for a short recess?
Short recess. Okay, we rise back from recess. So we're still on the Senate Bill 2305 dash 05. Discussion. Yes, Rapato.
Thank you, Mr. Chairman. I know that the Senate passed the legislation back in February with the version 23-05 SS1. The comments that you had provided the members of this committee came from the Civil Service Commission under the director of OPM, and she sent two letters, one dating March 13, 2023, and the other dating June 16, 2023, on this exact same legislation. Uh, OPM in the March 13, 2023 letter is in support of the legislation as is, without the substitute back in their submission of their comments to the Senate. Unfortunately, their comments on June 16, 2023 were not in support of the legislation. The reason why they're not in support of the legislation is because when they submitted their first comments on March 13th, they actually had the funding source to address the transfer. In their June 16th letter, it states that they don't have the funding source. This is coming from the same entity, in support of the legislation and not in support of the legislation. But also, they did not get the chance to review the substitute versions that the Senate had passed during their session. So I think it's important that we send the SS1 version for comments out to OPM and to Finance. I'm sure Finance is very clear that they want it out from their office, but OPM is with the understanding, or was with the understanding in their first letter, that they had the funds to address this issue. We understand that it used to be under OPM, but got transferred out to what was the retirement fund, and that's now under Finance. So I think it's important that we sent this out for comments to OPM, and if not that, maybe we can call them in to ask them on their position on the substitute version, so we can understand where they come from. But we need to understand that if we do pass this legislation, that OPM is also going to come and ask the legislature for additional funding and additional FTEs, and we're working on the budget right now. And if this is going to pass after the budget, we're going to have really big problems. OPM is going to be faced with a lot of issues. So I think it's important that we share this version with OPM so that they can set their position for that version that was passed in the Senate. Thank you, Mr. Chairman.
Thank you, Rapato. And that's it. No further discussion on this item. I will recognize the vice chair for the proper motion.
Thank you, Chair. At this time, I'd like to make a motion to table Senate Bill number 2305 SS1 for further comments by OPM on the substitute that was introduced. So move.
There's a motion and it has been seconded. No discussion.
Ready.
All right. All those in favor of the motion say aye.
Chairman, just point of clarification, that's the substitute is what the version, what the Senate passed. That's a substitute version. Not, we don't have a substitute version that's going to go out, correct?
No.
Okay, thank you.
Okay, so back to the vote, right? All those in favor of the motion to table Senate Bill 23-05, say aye.
Aye.
Those opposed? Okay, ayes have it. We're gonna table 23-05 until we get further comments and further clarification on the bill. All right, moving on our agenda, item E, miscellaneous. Anything open? Already. Okay, I'd just like to announce I got a reminder invitation for tomorrow's proclamation signing ceremony for pre-trial, probation, and parole supervision week. It's tomorrow, June 14, 10 a.m. to 11 a.m. at the Cagman Community Center. All members, and also the invitation was given out to our committee, are most welcome. Nothing further. Moving down to the next item, adjournment, and Vice Chair.
Thank you, Chair. At this time, I'd like to motion to adjourn.
Hey, there's a motion been seconded. Ready? All right. So, thank you again, everyone, and this. All those in favor of the motion, please say aye. Opposed, say nay. Ayes have it. We are adjourned. Thank you again for your attendance.